Hi, Dr. Jeff. Um, Man, you're a great doctor. I actually, when I was first learning about Suboxone um, and getting help, I actually got a lot of my information from your um, YouTube clips or whatever they're called. And thank you for putting these on here. You probably have no idea how many people you've helped. But, um, anyways, um, I think that you're right. It does depend a lot on the situation. Um, Here, I live in Washington, and different doctors do it different ways. Some of the doctors do, yes, require you to go to drug and alcohol treatment, outpatient, and go to meetings and stuff. Others don't. Uh, I personally went to a doctor that is making me go to treatment, which I have no problem with. I actually have learned a lot through treatment about myself. It's nice to talk to people. Um, just like many people have issues that I just didn't deal with because, opiates, they don't only get rid of physical pain, they do mask emotional pain also, which is, you know, something that was great for me when I was taking them. But when I stopped, I still had this pain um, that needed to be dealt with. But I've known other people who went to different doctors that didn't, that weren't required to go to any sort of treatment. Um, there's a girl, the actually a girl that I first got a Suboxone from, um, and she wasn't going to treatment. She was just getting the prescription, and she I don't think she was really wanting to change. I think it was more like family pressure. Um, they wanted her to get clean, and so she, got on this Suboxone, but she wasn't using it properly. In fact, she probably wasn't using it hardly at all. I know that the very first time I tried Suboxone, I actually traded her. She traded me one of her Suboxone for 9 hydrocodone 10s. So um, I think that it really does depend a lot on the situation. If you're in a situation like me where you're young and you still have a lot to learn, um, and you've been using painkillers um, more for the emotional pain than actual physical pain. It might have started off with physical pain, then counseling can be very beneficial. I mean, I know it's really helped me a lot, and the people that are my age in my circle that I would run around with and find pills and trade pills and whatever that whole world. Um, I've known two people that went to doctors where they weren't required to go to counseling, and they went specifically for that reason, and both of them have been unsuccessful in coming off of Suboxone or even just working the program correctly. Um, I am, I've been on since July, and I'm already being dosed down, and I'm very thankful, and I'm doing good in treatment. But I do understand what you're saying about people that are older who've been on pain management drugs for a long time. That I mean, their situation is different, but I do think that, like in my case and in other cases like mine, that it it is really important to have counseling. Um, that's just my opinion. And I'm not a doctor, but I know that it's really helped me, and from what I've seen with other people, um, they probably would have been more successful had they went to some kind of treatment, but like you said, You can't just make someone go to treatment and expect it to work. I know that for DUI in the past, I was forced to go to treatment for a problem I didn't think that I had, so treatment didn't help me at all. I just really didn't care. I didn't have a problem. I didn't, at least not with alcohol. I did with pills, but I didn't tell them that, you know what I mean? Because I wasn't ready. And I think that people that that are like in my situation who look around and look for a doctor to where they don't have to go to treatment. Maybe they are just using the Suboxone to get people off their back. Like my friend that I've been talking about, who, I mean, I feel that she found that doctor and went there because she didn't have to go to treatment, and that way it just got her family off her back, and so they thought she was doing okay. Well, until she was kicked off the program because they found narcotics in her system several times. But I don't know. I do think it is situational, but I think in situations like mine, young people like me, um, I think it helps because you waste a lot of your time being high and not really absorbing or dealing with the things that happen while you're um, in that addiction, and a lot of things can happen, and to just, you know, brush it all aside, it's just not a great idea. I don't know. I feel like it's really helped me a lot, but I was really ready. I mean, I was really ready to stop, so.